I've seen healthcare at so many different angles. And I think what hits home with me is there are a lot of great parts about healthcare and there are a lot of great gaps. And so when I really opened my practice, it was more of a place where it's a judgment free zone. We can personalize it and individualize it for that person, no matter what life stage they're in. My name's Mary Moret. I'm the CEO of Vital Forge Wellness Clinic located in Sierra Vista, Arizona. At Vital Forge Wellness Clinic, we offer hormone replacement therapy to both men and women and weight loss. And then we do some fun things like IV infusions, IM injectables such as NAD, B12. So, funny story is I thought I was going to be a pharmacist. I really enjoyed math, chemistry. And I first went to school to be going into pharmacy. My care really shifted in when I started as a dialysis technician, and it was that one on one patient care. So, that really shifted on how I went through my medical career. On my mother's side, they're all physicians. And on my father, he's the first nurse in our family, so I'm the first nurse practitioner. I think that's kind of where my care shifted when I thought I was gonna be in pharmacy, and now I'm a provider. So starting out, when I was a dialysis technician, I worked a lot with one-on-one patient care. That's kind of where it shifted my outlook before I started as a nurse. When I went into nursing, I saw healthcare at different angles, anywhere from teaching nursing students, working in neuro, tele, nephrology, dialysis, so that kind of shifted me achieving more into going into nurse practitioner, and then just going from that, doing primary, urgent care, nephrology, kind of where I see healthcare at all different angles was really great for me. So to be honest, it was kind of early on as being a nurse practitioner. I struggled with PCOS, endometriosis, doing everything right, exercising, dieting, lifestyle changes, and not seeing the shift on the scale. So when I got into hormones and found a really good provider to kind of help me get my hormones and my weight loss journey together, that's really what kind of shifted my interest into hormone care. Like every patient, sometimes we feel validated, sometimes we feel dismissed, and when I really found a provider that was validating for me, it started to connect the dots for me. So even struggling through PCOS, I mean, weight gain is just a struggle. 1 pound, even losing 1 pound is like a woo, like a win. But sometimes, I think when we get down on ourselves and we find a provider who really validates us, it's a great feeling to feel listened and to be heard. When I started with GLPs. I was 225 pounds. I lost about close to 80 pounds. I also started my bioidentical hormone replacement, testosterone. Going through perimenopause is very hard. And if anybody knows anything, when hormones start to decline, even especially for women, between pre, peri, or menopause, you can naturally gain 20 to 70 pounds. So I felt like all the cards were stacked against me when I had PCOS, weight gain, endometriosis, and perimenopause. And when I was able to work on optimizing my hormones with my GLP success, it really connected the dots. And I don't regret it. I don't look back at it at all in a negative way. It was a great experience for me. And that's why I do what I do. The way that healthcare is now, I've seen healthcare at so many different angles. And I think what hits home with me is there are a lot of great parts about healthcare and there are a lot of great gaps. And so it's more system driven versus patient care centered, especially when it comes to insurance dictating what's best for your patient. And as a provider, you can kind of feel defeated that way. And so when I really opened my practice, it was more of a place of where it's a judgment free zone and that, we can personalize it and individualize it for that person, no matter what life stage they're in. Feeling not pressured to be condensed in such a time specific range, not having one isolated problem, probably seeing a whole bigger picture and feeling like there's nothing too small or too out there to ask a provider. And I think that's important when you develop that relationship. So to me, that's what good care feels like. I think I just want patients to feel comfortable, just to know that, there's nothing too crazy. Like I said earlier, nothing too small or too big out there to ask. They're not going crazy if they have, symptoms as simple as fatigue or, even for, the ladies that, go through these big emotional shifts, your brain is just sensitive to these hormone shifts. And so is your metabolism and your body. So I just want my patients to feel like they're being listened to and heard. A lot of times when it comes to hormones, I think there's a lot of misinformation, misguided care. I think it's really important as health providers, that, what we say matters to the patients. And so guiding them and not telling them what to do is a better way of care, just because it allows the patient to really connect the dots themselves and feel like they're owning their own journey. So when I get a lot of patients, I love to see what they get on ChatGPT, WebMD, Google, or even, what they've heard from another provider and just sit there and kind of debunk myth versus fact and guide them. And it's really eye-opening because once you start to see that shift, whether it be 3 months, 6 months, 9 months, or 12 months, depending on where that person is, it's just a great feeling to see how they transform and feel validated. When it comes to weight loss, there's something, other than just oral medication, or I know GLPs is a big thing, out there to kind of help with weight loss. But I also think when we throw a medication, you can't just throw a medication, slap it on their hand and see them in 3 months. Like you're going to miss so much of the full big picture. So usually what I like to do is look at, at least 6 months or draw some labs because the metabolism plays a huge big picture. And there is something called GLP resistance or resistance in the metabolism. And some people surprise me who I think wouldn't have like a metabolic condition or resistance versus others. And so it's learning what kind of responder you are. Learning, it could be as simple as trading vitamin D or, if you have underlying insulin sensitivity. Those all play a big picture in your success to your weight loss journey. And if you don't get those right and you just take a medication, it becomes a crutch versus a tool to really help guide you. I mean, I live it every day, even when, work in urgent care, primary care, nephrology, insurance, you get a high extreme patient load, turnaround times. I mean, you do your best to try to help these people along their way, but sometimes it becomes isolated versus to one problem versus actually being able to have the time to allocate and create for those patients. So I think when I really looked at myself, I did a lot of self reflection in the beginning, early years of my career, because when I stepped into healthcare, you go in, you're like, I feel great. I'm going to be this provider. All these patients are going to be happy to see me. And then you realize you're slammed with, quick turnaround times, billing, insurance, and it just doesn't feel as rewarding as taking the time to really create those relationships, with patients or people along the way. Because at the end of the day, we're all people. And so being heard is like the biggest thing that I think people take away when they come to my clinic. There's so many. I would say that there's a couple that I could really, really, resonate with. For one weight loss patient, we have something called slow responders to GLP, and there's a thing called GLP resistance. And so if you don't take those labs and you factor in, it can be frustrating why you're not losing weight. One day I wrote this thyroid blog to talk about the thyroid and importance of, different markers in the thyroid, looking at it from a functional aspect, what can cause, poor converters. She was very, very great. She messaged me the next day. She goes, hey, we need to like look at my thyroid labs. And I was super excited. And I was like, oh boy, here we go. So it resonated with one of my patients. Sure enough, she was a poor converter. And secretly, she did a genetic test, which was pretty cool because she did find two genetic markers that caused her to have a poor conversion and have that metabolic resistance. And so once we were able to kind of treat her thyroid along with the GLP, she lost the weight and it was great. And so I'm just really proud of her success. Another one is a social worker. She did, one of my Cool FM videos for her weight loss journey. Originally, I think, she was around 310 pounds, 160 pounds, and did lifestyle changes. And I remember when we first had our first 20 pounds, yes, it's encouraging. But when you have a lot of weight to lose, because I've been there, 225 was my heaviest. And prior to that, I was always 140 pounds, which was great for me growing up. But when I had PCOS, so that was a struggle. So for her, 310 pounds was a lot. Everything she's done, lifestyle, dieting, exercising, it didn't help her lose the weight. And so there was some type of metabolic resistance. And she lost, I remember the first 20 pounds, we had a discussion of her doing maybe two 15-minute walks. And she looked frustrated but she knew what she had to do. And now we have a laugh about it because then the next month she walked 20 minutes every day and she lost 160 pounds, lifestyle changes on hormone replacement now. And she just looks amazing. Just to see her transformation was amazing. Hormones are discussed more. That's kind of my vision for the future. I'm hoping to see the shift in healthcare that I think needs to happen. We're never promised tomorrow. So everybody wants to feel their best, right? And, whether it's weight loss, whether it's hormones for both men and female, I'm really hoping that my clinic will thrive to shift that paradigm in the next couple years. I just want to be known for the person who helped guided you to get to your success. That's all I want to be known for is that you had somebody cheering you on in the background, as cheesy as it sounds. I just want to be known as that person who really helped listen and validated you.